Morning everyone, respected faculties and my friends. My name is Mihirwala and this video is part of my rubrics examination. Imagine you accidentally cut your finger and it needs stitches, but doctor doesn't make your whole body unconscious, instead only small area become numb. And that's where all local anesthesia work. Today I am going to explain local anesthesia. Local anesthesia are drugs that produce a temporary and reversible loss of sensation at the specific part of our body without causing loss of consciousness. So the patient remains awake but they doesn't feel pain. An important point to remember the order of the loss of sensation that is here. First pain, then temperature, then touch, then pressure, then muscle power. That means a pain disappear first, a movement disappear last. Now let's see the classification of the local anesthetics. As I mentioned here, the local anesthesia are mainly divided into two groups, ester groups and amide groups. Ester groups contain procaine, cocaine, tetracaine. Amide group contain lingocaine, bupivacaine, prilocaine, etc. etc. Mechanism of action. How do they work? Now let's understand a most important and interesting part of the topic. Think of nerve like an electrical wire. Normally, pain signals travel through the nerve using the sodium channel. A local anesthesia acts like a switching off the electric supply. First, the drug enters into the nerve. Then it blocks a voltage-gated sodium channel. As the sodium cannot enter, depolarization stops. Action potential cannot form and pain signals cannot travel through the brain and it results into the no pain or blockage of the pain. Let me give a clinical example. A patient come with you like a deep cut or it needs suturing, right? Instead of giving a general anesthesia, a doctor give a local anesthesia like lingocaine, right? The area becomes numb and the procedure is completed comfortably. That is called infiltration anesthesia. Now let's discuss the adverse effect. If a local anesthesia enter into the circulation in excess, the CNS effect, like we can see the tremor, restlessness, convulsions. It also cardiovascular effect also, hypotension, arrhythmia. It is common use. Local anesthesia are used in the dental procedure, suturing wound, minor surgeries, spinal and epidural anesthesia, labor pain management. Conclusion. Local anesthetics make a procedure safer and more comfortable by blocking a sodium channel and temporarily stopping the pain transmission while keeping the patient conscious. So that's for today. Thank you for watching.